In this lecture, we will be discussing specimen collection and processing, and this is a very, very important chapter. We start to get into some of the meaty parts of why we do what we do in the lab and how we do those procedures, how we work up these cultures, because the ultimate goal is to tell physicians what bacteria is causing their patient's infection and which antibiotics will treat those infections successfully. And it's important to know that the data or lab values that the lab generates is directly influenced by the sample quality and conditions. That's very important. You may see that again on a test question. The data or lab results generated by the lab is directly influenced by sample quality and conditions. So if we get garbage in, we will put garbage out, and we cannot do that. So specimen integrity is really important. First, we're going to talk about the basic principles of specimen collections. Specimens should be collected in the acute phase of infection, collected before antibiotics are given, because the antibiotics will interfere with bacterial growth in the microbiology lab. We need to select the correct anatomic site. If we have to alter the specimen type in the computer at all, that should be in the computer or come on the requisition already. For example, if there's a wound, we need to know exactly where the wound is. Is it the left arm, right arm, second toe, left great toe? And also we will get samples in cups and swabs that may just be labeled neck, or the samples in the cups may be not labeled, or to just be liquid. And liquids, urine can sometimes look like stool, bronchial lavage can sometimes be submitted as sputum. So the source and site needs to be on the sample correctly. Proper collection is very important. The goal of the person collecting the sample, whether they know it or not, is to maintain viability of any organisms that may be present and avoid contamination with normal flora. So that's number one, to avoid normal flora and colonizing organisms, because those will delay our culture results, because we're going to grow this out, and if we have to pick pathogens out of any normal flora, that's just going to take some extra time. The person collecting needs to collect the appropriate quantity of specimen. I mean, for example, if you have a gangrenous toe, we don't need the whole leg. And also, usually it goes the other way. There will be maybe a stool swab sent, and they expect a complete workup, a stool culture, serology test, and we can't do that. So usually the problem is getting too little sample, not too much. The specimen needs to be packaged in the correct transport media or stored properly, and we're going to talk about the different types of transport media. The specimen needs to be labeled accurately with patient information and the source. Again, the source would be sputum, urine, stool. Those can look like a look-alike sometimes. The specimen needs to be transported to the lab as soon as possible to avoid deterioration of the sample. And usually, if there's if it's a serious sample or unusual pathogens or bioterrorism, the person delivering it to the lab should tell us, but more than likely we're going to already know, because they probably would have had to have called the lab anyway to ask about transport or specimen collection. Aspirates and tissues, all of our samples need to be collected in sterile containers. Stools need to be in clean, leak-proof containers. Transport media can be used to prevent drying. Lesions and wounds also should be collected sterilely, and we want to collect those swabs from as deep in the wound as possible. Now, note that laboratory professionals 99% of the time, we do not collect samples. We collect blood samples, and that's it. We may have to do some patient education on patient collection, but we're going to get into that a little later in this lecture. And the nurses may call you to ask how to collect samples, but you need to refer them to the charge nurse if you don't know, because nursing has their own procedures to follow. And since we are not the ones that are collecting those samples most of the time, they should have a procedure for that. Okay, follow sterile technique, and that just means you avoid skin contaminants or any contaminants while you're collecting the specimen of interest. Swabs are not recommended most of the time because the quantity will not be sufficient and there can be some drying. We need to use Dacron or calcium alignate swabs. Cotton can be toxic to some bacteria, so we don't need to use those. Swabs can be used for upper respiratory tract, the external ear, the eye, and the genital tract. And here's an image of some common swabs that we would get, and those are just regular swabs. The nasopharyngeal swab is very tiny, and after 2020, we've probably all seen a nasopharyngeal swab. The steps to specimen collection: you want to clean the wound, explore the wound, and obtain a fresh and quality culture material, and remember to collect that wound, if it's a wound, from as deep as possible. Patient education, I mentioned this earlier, it's very important. Now, it may be our responsibility to teach the patients or explain to them exactly how to collect their sample. Attachments with pictures in multiple languages might be necessary, and you should never assume that a patient knows how to collect a specimen. And I'll tell you that this can really delay things. One of the common tests that patients collect at home that get messed up in the microbiology lab are stool occult bloods and stool samples. And I'll tell you the most interesting samples that I ever had. One was a stool occult blood. It's just a card that you open up, and it has filter paper on the inside. And the patient is supposed to take some stool with a popsicle stick or swab and smear it on that filter paper and then close the cardboard card packet back up. Well, we had one time, and the stool was all over the outside of the card. The patient had never opened it. So that's not really good. And then one time I had a stool culture, and I opened up the container. I'm going to show you some pictures later on of what this container looked like, but it was a round tube with a screw cap, and I screwed the cap off, and there was like kind of a white substance on the top, and I took my loop and tried to touch the stool, and it was hard as a rock, and those were ice crystals. The white stuff was ice crystals. So this patient had put their stool in the freezer, and we could not use it anymore. So it should not be assumed that a patient knows how to collect a sample. You may have to tell them not to put their poop in the freezer. For example, we need a clean catch midstream urine specimen. The first morning urine sample is best. And notice I made this picture with you in mind. Here's a stream, and here's a urine in the middle, and our fisherman is catching it very cleanly, and it looks like it's the morning. So the midstream urine collection is important because the first part of the stream washes away contaminants from the urethra. So that keeps contaminants, and if there's any bacteria that grows there, that means it should be a pathogen, a true pathogen. The procedure is similar for catheters, but catheters should not have any bacteria at all, whereas urine samples, we're going to get into that later, a few bacteria, especially if it's several different kinds of bacteria, are not considered significant. Sputum collection has to be just that, sputum and not spit. The first morning specimen is preferred again. It can be difficult to collect, and we have to do direct examination, gram stain smears, to verify that we do have sputum versus saliva or spit. Yeah, so that's all for that. So sputum, we're going to get into that a whole lot more. Stools, if we need, usually we'll have to get 3 samples to confirm, say, Clostridium difficile or some other type of bacterial infection. And if the doctor has ordered 3 stool cultures, that means 1 a day for 3 days, not one sent all 3 stools in the same day. And nursing staff may not realize that, so you have to be careful. And this also goes for for sputum cultures. They quite often are ordered for 3 consecutive days or 3 sputum cultures. And especially when we're doing acid-fast bacteria, we need 1 a day, 1 sputum a day for 3 days. We cannot accept a sputum at 9:15, 9:30, and 9:45 in 1 day from the same patient. That's very important. Know that that means 1 a day for 3 days for stools and sputums. Stool is never taken from the toilet, and we can't use it if it's contaminated with urine. And the ratio of preservative to stool, 3 parts preservative to 1 part stool. And we cannot use a stool if it has barium contamination. And I just love this meme. We're probably going to have a lot of poop jokes, and we're going to talk about it a lot. Test requisitions must accompany the specimens, and now these are usually in the computer. There will be a test requisition or order in the computer. And this has to have, if it's an outpatient especially, there's a requisition that has to come with it, with the patient's name, the specimen type, the room number or location if it's an outpatient, the physician's name, because we have to know who to send the results to, the specific site or source, remember whether it's sputum or urine or stool or what, the time, that includes the date and hour of the specimen collection, because we have to know if it's a urine for a culture and it's been sitting on the counter at the clinic for 24 hours, we cannot do a culture on that. Safety is important always. We follow standard precautions. We are going to hope for leak-proof secondary containers. So what that means is you have a urine in a cup in a biohazard bag, and that biohazard bag should be leak-proof. Because what happens is we often get urines that the patient or staff has not secured the lid, and it leaks in the bag, and then we can't use it anymore for culture. We could do a urinalysis, but it's also not very safe to send things like that in the tube system in the hospital, but it happens. Also, we should not accept syringes with needles that are still on. Always use your PPE, and it's very important, if it is available, to process specimens for microbiology culture in a Class 2 biological safety cabinet. And the Class 2 is the one that has the sheets of air. The front is open, but there's usually air blowing, kind of like when you walk into the grocery store and you notice that sheet of air. That's trying to keep the bugs out, the literal bugs like the flying insects. It's the same idea with the Class 2 biological safety cabinet. All right, I'm going to jump back up to the stool specimen, and we need to talk about the specimen of choice for gastrointestinal pathogens. And you think about the whole GI tract, which is from, the mouth to the exit anus. And so what is the best specimen for GI pathogens? It is going to be stool, and not a swab, but a stool sample. And of course, not urine, and then vomit is not a great sample either. So the specimen of choice for GI pathogens is stool. And you will probably do a lot of those. Specimens should be transported to the lab within 30 minutes when at all possible, preferably within 2 hours. We should use the specimens immediately if possible. And we're going to talk about storage conditions for certain pathogens, but some can be stored at room temp. Some can be stored in the refrigerator, and some need to be frozen. And this is important, but not always possible, because remember, one of the revenue generators or ways that labs make money these days is by having outpatient clinics, or where they go and pick up lab samples at physicians' offices. And there are a couple of hospital systems in this area that do that. So there will be a courier, and maybe they'll drive from, let's say, Ocean Springs to Van Cleve to pick up samples, but they don't drive immediately back to Ocean Springs to the hospital or Pascagoula to the hospital. They make the route through the rural communities or the clinics in town before they take one big batch back to the lab. Okay, so anticoagulants are used in our microbiology samples sometimes, but we need to know the ones that are acceptable for microbiology, and that is SPS, sodium polyethanol sulfate, and this is okay for most bacteria, and this is the anticoagulant used in our blood culture bottles. Heparin can be added to usually joint fluids, and we don't really do cultures much. Usually if we have a culture from a fluid, we're going to get a swab or fluid in a red top tube, and we can set that up. But heparin, we can use. Coagulants that we don't use, citrate or EDTA, and this image is to remind you about all the anticoagulants that we can use in the laboratory. Just not all of them can be used in the microbiology lab. What preservatives can we use in the microlab? Urine, if it's preserved with boric acid, that's okay. This is mainly for colony counts. Usually we are going to be using urine so quickly that we don't need a preservative. The tricky preservatives are for stool. So look at this image up here. Each one of these has a different preservative except for this white container. So potentially you could have a stool sample that's divided into all of these containers. So this one, the green top, is for ovocysts and parasites. It has formalin and PVA in it. This orange one has Carrie Blair, and this white one is empty. It has nothing, no preservatives. It's just a sterile container. So I've never worked anywhere where I had any of them but these three. For parasites, culture, a few serology tests, and then the empty sterile container. So the stool can be preserved with phosphate buffered saline, but we don't usually use that. We're going to use Carrie Blair, and we're going to come back to that in a minute. But we can preserve stool with phosphate buffered saline, Carrie Blair, but not anything like salt water. That would be silly. Transport media is used to preserve the organisms in the sample, and this media should provide viability without allowing multiplication or growth of bacteria. And they do this, they have to maintain the pH, the proper atmosphere. For example, if you are suspecting an anaerobe, you need to have this collected in an anaerobic gel. And some of these bacteria are very fragile or somewhat fragile, so you need to maintain their atmosphere and prevent them from drying out for sure. And examples of this are Stewart's, Amy's, and Carrie Blair, and we'll talk about those more as the semester progresses. And remember, aspirates are usually collected and transported in syringes, but those needles need to be removed. We're going to pause here. It's about 20 minutes, and this is going to be Chapter 6, Part 1, and we're going to pause before we go to Part 2.